speaker gets on. But I'm Jeff Davis. I'm the executive director of the MSU Alumni Association. I'd like to welcome all of you to Bulldog Bites, which is our new virtual speaker series featuring faculty, staff, researchers, and alumni of Mississippi State University who are eager to share their work, expertise, and impact on a wide variety of unique and interesting topics. We're really looking forward to showcasing some of the extraordinary people and programs that our university has to offer through in the MSU community. And we hope that you're going to enjoy our exciting and interactive new virtual speaker series. Today's installment of Bulldog Bites will focus on using communication science to address today's pressing health issues. We're so very pleased to have our featured speaker, Dr. Holli Seitz, who is an MSU alumna and an assistant professor of communication here at Mississippi State, where she specializes in health and science communication. We're also very fortunate to have our moderator joining Dr. Seitz this morning, Dr. Terry Likes, who is full professor and head of our Department of Communication here at MSU. We encourage our viewing audience to utilize the Q&A feature here in the WebEx platform. And for those that are tuning in via Facebook Live, you can submit your questions via the comment section. But I think we're ready to get started. So at this time, it's my pleasure to turn over the program to Dr. Likes and Dr. Seitz.
Jeff, thank you very much. It's a real pleasure to host this inaugural edition of Bulldog Bites and to bring in one of my colleagues. As Jeff said, I'm Dr. Terry Likes. I'm the head of the Department of Communication, now entering my second year here at State, and it really has been a real pleasure to be here in Starkville and to work with so many talented people. My background's in the media, having worked in radio and television, and as we start this fall semester, I can't believe it, but I'm entering my 32nd year in higher education. So I've been hanging in there, working at several different schools, but thrilled to be here in Starkville. As Jeff said, an important topic today, using communication science to address today's pressing health issues, and we have no one better to discuss that with us than Dr. Holli Seitz. I'm pleased to introduce her. She's currently an assistant professor of communication here at Mississippi State, excuse me, where she specializes in health and science communication. She received her bachelor's degree here and went away and came back, and so we're so happy for that. She went to Birmingham, got her master's degree in public health at the UAB, and then went to the Ivy League up in Philadelphia to earn her doctorate in communication at the Annenberg School of Communication at the University of Pennsylvania before returning here to join our faculty. In the classroom, she's really talented, great rapport with the students. She teaches such courses as Elements of Persuasion, Introduction to Communication, a course in health communication, which is pertinent for this discussion. And she's also positioning herself to teach a new course soon in science communication. Outside of all of that, she is the director of the Message Laboratory. It's a communication research lab here at State in the Social Science Research Center. Her work on creative, effective, healthy communication messages have been published in a variety of journals. I'll just list a few: Science Communication, Communication Monographs is a big one in our discipline, Patient Education and Counseling, and Psychology and Health. So, Holli, you've done a lot since you came back here to State. Thank you so much for joining us. We're thrilled to have you with us.
Thank you so much, Dr. Likes. It's an honor to be doing this webinar and to get to speak to Bulldog Nation today. So thanks to everyone for joining us.
Well, we have some questions for you, and as Jeff said, we'll keep an eye on the chat and the Q&A functions. But first, we're going to talk about coming up the Promise Initiative, MSU's new Cowbell Well campaign, and how we deal with misinformation. But let's start off with some of the work that you've been doing. Tell us, how do we make messages more effective?
Well, if you have been watching the media, if you've been on social media, if you listen to the radio, you may have heard or seen advertisements that have a goal of getting you to change some aspect of your behavior to make you healthier. And so the big question that's really been driving my career is, how do we make those messages better? How do we make them more effective so that people are more likely to pay attention to them, to remember them, to actually change your behavior as a result? And that's really the work of a communication scientist. I see myself as an applied communication scientist who's working on these issues related to health communication and science communication. The goal of my time together with you today and with those who are watching is to talk about some of those projects that you mentioned. Within each of them, I'll be talking about ways that we can use methods within communication science to help us make those messages more effective. Things like making our recommendations really specific, using concrete language, increasing the audience's confidence in their ability to act on those messages. So for people who are joining because they're interested in this area, I hope that you'll find something interesting and learn a little bit about communication science. But I also know that we have some actual communication practitioners joining us today. And so for those who are communication practitioners, I hope that maybe I can give you a few ideas to take into your own practice. Definitely, if you have questions, if you're coming in through Facebook, please post them there. Use the question and answer feature here within the WebEx platform, and we'll get to as many of those as we can.
Holly, let's talk about the PROMISE initiative. And PROMISE stands for Preventing Opioid Misuse in the Southeast. You've helped the project team use communication research techniques to develop and test messages, as you were alluding to. And these are designed to encourage people to engage in behaviors that will reduce opioid misuse here in the state of Mississippi. Really important and very timely. What are some of the behaviors that you recommend?
Some of the things that campaign is trying to encourage people here in Mississippi to do are things like securing any prescription medications that are in your home. Keep those away and in a locked cabinet if possible. We also want people to properly dispose of medications, specifically pain medications like those in the opioid class. We want them to monitor the use of opioids in their home. If you're taking medications, keep a written schedule, mark when you're taking doses, and then we also want them to be talking to other people in their lives about the use of opioids. Talk to children about the proper use of medication. Talk to older adults in your life about their medications, help them organize those. And also talk to your healthcare providers, your nurses, your physicians, your pharmacists, to ask questions about the medications. You know, Terry, as we were crafting the media campaign component of this work, we've been working with a creative company called Fahrenheit Creative Group out of Jackson. And with that group, we actually went back to very fundamental communication research techniques, interviewing people in our priority population. We sat down with them. We had some draft messages that we were thinking about using for social media messages or in short videos that might play on TV. We sat down with them and asked them about these messages. Are the messages clear? Are we using language that you use? Are these messages appropriate for your community? What do you think about these images? So those are the types of questions that we would ask in those interviews. It's exactly the process that I teach my health communication students. And we got some great findings from those interviews. We found, for example, that the adults that we most wanted to reach, they don't use the word opioids when they talk about these types of medications. Instead, they might use some of the generic or brand names. So they might talk about Vicodin or Oxycontin or morphine or fentanyl. Or they might talk about painkillers or pain medications. And so we used this to shape our messages. And we said, if you're using the word opioid, which our sponsors really wanted us to, because that's the most precise way to talk about it, you also want to use a definition along with that, like pain medications, painkillers, that will resonate with your priority populations. So that was a big takeaway of that. We also found that many people in our audience were not aware of these things called prescription drug take-back boxes. And getting people to dispose of medications was one of the key behaviors that we wanted them to do. And so these prescription medication take-back boxes are available in some of the chain pharmacies. And we just had to tell people about them and also tell them how to find them, how to use them. And so anytime you're doing something like that, you want to raise your audience's confidence in their ability to do the behavior. And you can do that by modeling the behavior that you want them to take, and also giving them the steps to take to get to that behavior. So those are ways that we increase what we call self-efficacy in our audience.
Well, Holly, this is so important to be able to share the research and what you've been able to find. And fortunately for you and the team, this project has been funded for another 2 years, so this work can continue. Now, before we get to Cowbell Well, you've been recognized and even interviewed by Hearst Television, so some real national recognition about your research and dealing with the coronavirus and messages. Why do messages go viral and how does this shape behavior? Because this is something we've been dealing with now for a while.
What an interesting question, Terry. I'm glad you asked that. So, first, I do want to make a distinction between what makes a message go viral versus what makes it effective. Just because someone shares a message does not mean that it will necessarily have the types of effects on a behavior that we might want. So, there's a really interesting line of research by a scholar named Jonah Berger, who was actually at the University of Pennsylvania. And he has a whole book called Contagious, where he summarizes some of the research that he's done on what makes messages more likely to be shared. And one of the things that he finds is that a message, in this case, maybe a social media post, that evokes a really strong, activating type emotion, like anger on the negative end, or something like awe and wonder on the positive end, is more likely to lead to that message being shared than one that evokes an emotion that is a calmer emotion. So sadness is not this high activation emotion that's going to lead someone to share it. So those are the types of things that might make a message go viral. And that was what Hearst Media was most interested in. They were seeing messages go viral and they were really curious about that.
Holly, we have a question from the audience. Is there a prescription take back box on the MSU campus at the Longest Student Health Center?
Oh, that's a great question. To my knowledge, there's not one at the health center, but sometimes they're in law enforcement agencies. So there are several in the Starkville area, and some are in the chain pharmacies in town. For example, I know that there's one at CVS because I've seen it. Some of the police stations may also have them. And there is actually a website online where you can search for the prescription drug take back box closest to you. And I promise that I will find that link and I will share it maybe in the Facebook comments after this event ends. It's a great question. Thank you for that.
Well, you mentioned Facebook, so we have a question from a viewer there. How are communication strategies changing since COVID-19 in the health sciences field? What trends do you see developing as a result?
Ooh, how interesting. I would need to think on some of the major themes that we're seeing. Personally, I try to revert back to the very basics of communication research, the things that I know already work that we might be able to use in this environment. So I've been thinking about some of the tried and true strategies, but I know that we will see some changes. So, some of the things that I think about the types of health communication and health behavior theories that have worked for other similar types of events and then try to apply them here. We're going to talk about misinformation later, and that may be a good place to come back to this and we can talk about COVID related misinformation and how we may want to approach that. So if you're okay with that, Terry, let's hold on to that question and come back and make sure we talk about that with COVID.
Sure. Let's transition to Cowbell Well because that's important in this community and around the state, and certainly as we begin another semester here on campus. As part of the response to COVID-19, you're working with a group that's developing health education messages for students in this case. You've led the research effort, you've talked with parents, you've talked with students, learning about behaviors, things that some of us are aware of, some of us are not quite as aware, wearing a face covering, maintaining the physical distance, staying home when sick. What are some of your recommendations regarding the COVID-19 messaging that we're trying to get out to the public?
Yeah. So for our research for the Cowbell Well Initiative, where we are trying to encourage prevention strategies that will help limit the spread of COVID-19, we're trying to get people to do things like wear face coverings, to maintain physical distance, to stay home when they're sick. So you mentioned we went back to that interview strategy. We started our formative research, which I recommend people do when they're crafting messages from scratch. And we also used a guiding model, a framework for this communication called the health belief model. And so when I mentioned those tried and true communication strategies, the health belief model has been around for many years. And it is just a way of thinking about the factors that might lead someone to take a particular health behavior. And so within the health belief model, elements of that are how severe does your audience think the health threat is? So in this case, how bad is COVID if you get it? We wanted to explore those types of beliefs. We also wanted to pursue beliefs about how personally susceptible an individual feels to the threat of COVID-19. So how likely am I to get COVID? And then two of the big ones that we really delved into for each of the behaviors that we wanted to encourage were the benefits of doing the behavior. What are the benefits of wearing a mask, for example? And the barriers to doing a behavior. What are the things that might keep someone from wearing a mask or from staying 6 feet away from a friend when they're talking, or what might keep them from staying home when they're sick? Those were the major things that we sought to answer in those interviews. And then we use that information to help guide the messages. So, for example, most people, when we talked about the barriers to doing the behaviors, most people said, you know what? Really, the only barrier that I might face with that particular behavior, like cleaning my hands often, it's just I might forget. So, I'm going to need a reminder. Or I might forget to do the daily health screening. So, make sure you make it easy and fast and remind me to do it. So, part of our communication strategy has been to craft frequent reminders in new and fresh ways to remind people, to put on their mask when they're leaving their car and coming to campus. Or maybe there's a sign on the door when you get to a building to remind you to put your mask on. For other behaviors, people said, I might not be as likely to stay home when I'm sick if I'm really worried about missing information in class. And so for that, we made sure that we communicated with administration that they needed to work with faculty members to craft an attendance policy that was going to work for students and to be able to encourage students to stay home when they're sick and find alternative ways to get them that important instruction. So again, we went with that interview strategy. And we've been able to use that to really gain some key insights into the concerns of our students. And also, like you mentioned, we interviewed parents because parents have a huge influence on the health behaviors of their students.
You talk about things like wearing face coverings, and there's even been a debate about that. So it brings me to misinformation. You talk about messages and the right types of messages. Correcting misinformation. It's a health and science misinformation is certainly rampant in social media and harmful or can be harmful effects on our health. So you've worked with a former student to conduct an experiment regarding misinformation in social media. What are some of the takeaways of your research?
Yeah, misinformation is rampant today. One of the interesting things about social media is that many people can have a voice, and that obviously has huge benefits, but also it can bring up some concerns. So, misinformation is usually defined as information that's incorrect, sometimes and usually accidentally. Some people distinguish that from something called disinformation, which is incorrect information that is usually sent out with some sort of ill intent. And within, the coronavirus outbreak, we've seen a lot of incorrect information on social media and also really useful messages being shared, usually by health agencies and health authorities. Within the experiment that you mentioned, one of the things that we were trying to do was see if there was a way to correct misinformation once it's out there. One of the things that we know about incorrect information is that once you learn it, it's very difficult to unlearn that information. It really sticks and it's difficult to unstick. Some people have said that you can maybe prevent misinformation from sticking by using what they call an inoculation. So, in the same way that a vaccine can inoculate you against a virus, an inoculation message can warn that you may come across some incorrect information. And when you do, you need to discount it. So, that's the way that inoculation works. But once someone's already been exposed, we wanted to try to find a way to help correct that information. So the experiment actually tried posting corrective articles underneath an incorrect article in a Facebook style setting. And we found that posting those corrective articles underneath could have, a slight correcting benefit. The problem, though, was that we found and further confirmed that any exposure to misinformation, even if it's immediately corrected, is going to have harmful effects on the beliefs of the people seeing those messages. So, the biggest takeaway for me was that any exposure to misinformation is going to be harmful, so limit that if you can. But for people who are trying desperately to correct some sort of misinformation, some incorrect information maybe that's gotten out about your organization, the biggest tip from communication scientists is to never repeat the misinformation as you're correcting it. Never restate what was wrong, only state what is true. And because if you restate the incorrect information, you are then not only reinforcing it for people who may have heard it, but you're introducing it to people who never heard it in the first place, and that can have those harmful effects. So state only what is true, and that is one way that we can start to correct misinformation. But unfortunately, this area of research is not yet, fleshed out. Many communication scientists are working on this exact issue. And so I would say, somebody asked earlier about trends in communication science. At this time, one of the big things that I'm seeing is that people are all grappling with misinformation. How can we prevent the spread? How can we prevent it from sticking? How can we correct it when it's there? And we've seen just a huge spike in people talking about this, and rightfully so. I mean, we're in the middle of a global pandemic. This is obviously an issue of concern. There's also a lot of divisiveness, and also interestingly, health topics have come to be associated with different ideologies. That's a fascinating trend that I've seen that has been happening for some time, but we're also seeing that now. So all really interesting things within the communication research world.
Very important information, Holly. We have just a few moments left. Is there any final information you'd like to share with our audience?
Wow. Well, that is a bold charge to leave them with some great information. I would say that if you are crafting a message, try to always model the behavior that you want your priority populations to take. So you probably heard the quote, be the change you want to see in the world. In this case, my charge is model the change you want to see in the world. If you want employees to wear face masks, make sure that you're always showing images of others wearing face masks. If you want people to stay 6 feet apart, please, in your images on social media, have people standing 6 feet apart. So model that change, and that not only helps to reinforce what we call social norms, or this belief that other people are doing it, which is a really powerful social force, but it also shows people how to do it. So if I don't know how to interact with my neighbors and still physical distance, show me a picture of neighbors sitting in lawn chairs in their separate driveways, still interacting. And that gives me ideas for how I can put these health behaviors into place.
Let's squeeze in one quick question that just came in. Where do you recommend Bulldog students, faculty, alumni, supporters go for the best source of information on things like COVID-19 or other pertinent news?
Well, we do have a university website that has brought together all things COVID. And actually, the link that I wanted to share with you is for the Cowbell Well Initiative, which brings together some of these health recommendations and is also linked to that COVID information. So if you go to www.msstate.edu/cowbellwell, that's Cowbell, WELL, you'll be able to find more information about our recommendations on COVID-19.
Holly, thank you so much for all of this information and for joining us as our guest on this inaugural edition of Bulldog Bites. A real pleasure. For those who joined us and watching, we appreciate that. Also, I would encourage you to please see the Alumni Association website for more webinars, and you can log on to the Department of Communication website at comm.msstate.edu for more information, including contact information for talented faculty such as Dr. Holli Seitz. So again, thank you everyone. Please join us next time, and hail State.